talked about various ways of treating fibroids. One way of treating fibroids is actual medication. So let's talk about that a little bit. Probably the most common and actually a really effective way of treating fibroids and the heavy bleeding is birth control pills. Birth control pills for many patients will decrease the amount of bleeding. Now, the birth control pills are not likely to shrink the fibroids, but they can definitely help when bleeding is your primary symptom. Some other ways of treating the fibroids are a medication called Lupron. It is what we refer to as a gonadotropin-releasing hormone. Okay, that's a mouthful, but basically what it does is reduce the amount of estrogen in your body and actually almost mimic a pseudo-menopause. This medication can be very effective for bleeding and fibroids. We also use it when we're planning a surgical procedure like a myomectomy or a hysterectomy, but the bleeding is very heavy and we have to wait to do the surgery, or the patient is very anemic and we just need to buy some time. So that medication can be very helpful. It's very good at stopping bleeding. It can shrink fibroids a small amount. However, there are side effects, and so it's not a medication that can be used long term. We also use something called, I'm going to butcher this name because I do every day. I call it TXA. It's really tranexamic acid, and it's a medication that we use during the menstrual period for several days out of the menstrual period, and it's a little bit newer to the scene, if you will, but it can be very effective at decreasing the blood from fibroids as well. We also sometimes use pain relievers like non-steroidals. Now you have to remember, all of these medications don't work or not appropriate for every patient. Some people's medical history or family history will not allow them to take certain medications. So even if you hear about them here, they're good questions to ask your doctor, but they may or may not be right for you. And then of course it's important to have iron and vitamin B12, and guess what else? Vitamin D. It turns out a vitamin D deficiency, and we've seen this especially in African American women, can make the fibroid situation worse. So it's really important, one, that maybe you get tested for vitamin D levels, and we want really strong vitamin D levels, and then also getting on vitamin D, because as it turns out, most of us, especially those of us in colder climates, are vitamin D deficient. And a lot of African American and people of color, melanated people, tend to actually be vitamin D deficient, which people miss because they assume we have enough melanin. So it's really been a really well documented kind of exaggerated problem for people with abnormal bleeding, but really from fibroids. So getting your vitamin D levels checked and starting some vitamin D. So you need iron, because a lot of people will become anemic from all of this bleeding, vitamins and a good supplement, and some vitamin D along with those other medications. And then two new ones on the scene are medications that can also function to reduce the blood loss and maybe cause a little bit of shrinkage. But these are all great questions to sit with your primary care, your gynecologist, to go over.